The unspoken risk. When embarrassment leads to stage 4 prostate cancer, early warning signs, and advanced robotic treatment. Hello, everyone. I'm Dr. Robert Thompson, a board-certified urologist with over 47 years of experience caring for patients right here across Canada. Today, I want to talk about something we all do every day, often without a second thought: urination. You see, your urine sends us vital signals, subtle messages about your health. Have you ever felt the urge to go again right after you just went? Or experienced a sudden, urgent need, perhaps a little leakage? Maybe you've noticed a faint pinkish tinge or a persistent fatigue that makes you wonder if your body is sending a quiet, serious warning. It's a sensitive warning, isn't it? Yet, we often dismiss these signs, pushing them aside. It's a common tendency. People are diligent about heart checks, brain scans, but when it comes to the pelvic region, many hesitate to see a urologist. Frankly, that's a concern for us in the medical community. We understand that discussing these intimate areas can feel uncomfortable, and there's often a quiet reluctance among men, especially to talk about down there. But your proactive approach can truly make all the difference, because sometimes quietly growing within your pelvis is cancer. Prostate cancer and bladder cancer are two of the most common cancers in this region. Blood in your urine, for example, is a classic symptom of bladder cancer, but it can also appear with prostate cancer. The speed at which you seek medical attention can significantly alter the course of the disease. How do we spot these cancers in the organs vital for reproduction and urination, and how can we protect ourselves? Mr. John Davies, a 68-year-old from Vancouver, knows this all too well. He's been living with stage 4 prostate cancer. The 2 weeks waiting for my test results, he recalls, were incredibly nerve-wracking. You just keep wondering, has it gotten worse? His journey often involves long trips from Vancouver to Toronto for specialized treatments, a reality for many Canadians seeking specialized care. The fatigue from travel pales in comparison to the unfamiliar and challenging side effects of his hormone therapy. Sometimes I get these intense hot flashes, he describes, and my face is constantly flushed. Last night, I was sweating profusely, even though it was cold outside. I had to open a window. It's like experiencing menopause, but as a man, and it's quite intense. Prostate cancer often develops without distinct symptoms. The prostate is a walnut-sized gland in men, located just below the bladder. It produces about 30% of seminal fluid, helping sperm move actively. It sits right in front of the rectum and is surrounded by crucial urinary sphincter muscles, blood vessels, and sensitive nerves involved in erectile function. While prostate cancer is most common in men in their 60s and 70s, Mr. Davies was diagnosed at just 65. So, what did his latest test results show? We've been combining hormone therapy with chemotherapy, his doctor explains, and his prostate cancer has shrunk significantly. The lymph node involvement visible on the MRI has reduced, and even the bone metastases have decreased. Mr. Davies' cancer had spread to his pelvic bones and surrounding lymph nodes, but he's responding well to treatment. The question now is, what's the next step? Radiation therapy can kill cancer cells, offering the potential for a cure, says his doctor. It's also quite effective for localized spread to lymph nodes, but when it's spread to the bones, it becomes a more complex decision. Stage 4 prostate cancer makes radiation therapy a challenging choice. Radiation can destroy healthy cells too, so we're hesitant, Mr. Davies shares. They say it's usually a slow-growing cancer, but once it spreads, it's incredibly tough. If only I had managed it from the beginning, it might not have come to this. He often wonders, how far had his cancer spread before he knew? Prostate cancer staging is determined by tumor size and spread. Stage 1, tumor not felt on exam. Stage 2, tumor confined to the prostate. Stage 3, tumor extends beyond the prostate capsule or involves seminal vesicles. Stage 4, tumor invades adjacent organs other than seminal vesicles, or is spread to lymph nodes or distant organs. This is all cancer, a doctor points out, indicating a large tumor on a scan. It's so large it shows areas of necrosis. Normally, the prostate should be this size, but his cancer has invaded, and the tumor size is significant. This large tumor caused urinary blockage and severe pelvic pain. His regret traces back 8 years. In 2017, he underwent surgery for benign prostatic hyperplasia, BPH. During that process, his PSA levels were significantly elevated, but he dismissed it, thinking he was too young for cancer. I was still young, so I thought it must be BPH, he recalls. I didn't pay much attention. He had some urinary symptoms. So during a routine checkup, his urologist did a PSA test. The number was high, he remembers, but they kept telling me it was unlikely to be cancer for some of my age and just kept prescribing medication. While he was complacent, the cancer was aggressively growing. He overlooked the elevated PSA in his blood test. PSA, or prostate-specific antigen, is a protein enzyme specifically found in higher levels in men with prostate cancer. If this level exceeds 2.5 to 3 nanograms per milliliter, further tests are crucial to check for prostate cancer. PSA is a normal protein produced by the prostate, so a high level doesn't automatically mean cancer, the urologist explains. When PSA is high, we perform a biopsy to confirm if the elevation is truly due to prostate cancer. Since prostate cancer often has no early symptoms, paying close attention to your PSA levels is vital. Keep listening. Next, we'll discuss a patient's journey with robotic surgery and the crucial connection between your bladder and prostate. Welcome back to Urologist Canada. I'm Dr. Robert Thompson. In our last segment, we discuss the importance of listening to your body signals and the challenges of early detection for pelvic cancers. Mr. Michael Thompson from Calgary recently faced a similar challenge. After undergoing surgery for ureteral cancer last November, routine blood work revealed an elevated PSA level. He immediately sought medical attention. My blood test showed an unusually high PSA, he recounts, and my doctor suggested an MRI. Sure enough, there was about a 1 centimeter growth on my prostate. Because he didn't ignore the elevated PSA, his prostate cancer was caught early. Mr. Thompson is now preparing for robotic prostatectomy. In terms of treating the cancer, there is a significant difference between robotic and open surgery, explains a surgeon. However, with robotic surgery, patients tend to recover faster from incontinence. The ability to preserve erectile function is also generally better with robotic surgery, and the quicker recovery allows patients to return to work and daily life much sooner. Mr. Thompson, still in the prime of his working life, received a prostate cancer diagnosis. Prostate cancer is rapidly increasing among men, largely due to westernized diets. While age is the most significant risk factor, with the majority of patients in their 60s and 70s, Mr. Thompson is still in his 50s. Prostate cancer incidence increases sharply with age, says his doctor. It's relatively rare under 40, but it increases dramatically from 50 onwards, peaking in the 60s and 70s. Of course, with extended lifespans, we're now seeing more cases in men over 80 as well. That afternoon, Mr. Thompson underwent surgery to remove his prostate. We found prostate cancer in 4 out of 11 biopsy samples, and the malignancy was intermediate grade, his surgeon notes. There was a 1 centimeter growth on the front part of his prostate. Having already undergone open surgery for ureteral cancer, Mr. Thompson feared another open procedure and opted for robotic surgery. During robotic surgery, small incisions are made to insert a camera endoscope and robotic arms into the abdomen. The surgeon then precisely controls these arms from outside. For Mr. Thompson, whose cancer was confined to the front of his prostate, the goal was to meticulously separate the prostate from the erectile nerves, minimizing damage to preserve sexual function. The procedure concludes by rejoining the urethra and bladder. The next day, Mr. Thompson is bright-faced and recovering well. "You're doing great, Mr. Thompson," his nurse says. "Are you getting some exercise?" "Yes," he replies. "I'm walking well. Only coughing is a bit tough." His surgeon notes, "I was concerned about infection or severe adhesions due to his previous kidney and ureter surgery a year ago. We took extra precautions, and thankfully, it wasn't a major issue during the operation." Robotic surgery is known for faster recovery and fewer complications, and the smaller scars are a significant advantage. No large scars, Mr. Thompson shares, just small points, which is great for privacy, and the pain is definitely less than with open surgery. As Canada's population ages, pelvic cancers are gaining more attention. The pelvis houses organs vital for bowel, bladder, and reproductive functions. The structures differ slightly between men and women. In women, the bladder is in front of the uterus, while in men, the bladder is in front of the rectum, with the prostate just below the bladder. The prostate and bladder, in particular, are close neighbors along the urinary tract, and they significantly influence each other. If the prostate becomes enlarged, the bladder may not function properly, explains a urologist. Conversely, if bladder cancer invades the prostate, it can have similar effects. Their close proximity means they interact a great deal. The prostate has its own functions, but also impacts bladder function. Since the urethra, the tube for urine flow, passes through the prostate, inflammation in the bladder means inflammation in the urine. Blood in the urine, a hallmark symptom of bladder cancer, can also occur with prostate cancer. Therefore, when experiencing urinary symptoms or blood in the urine, it's essential to check for both bladder and prostate cancer, not just one. Prostate cancer is the fastest growing cancer among men in Canada. While bladder cancer has a high 5-year survival rate, its recurrence rate is also high. To transform these daunting cancers into manageable conditions, early detection is paramount. By understanding the subtle signals from your urine and blood, we can conquer cancer. So, I ask you, how often do you visit your urologist? For prostate cancer, screening is simple. A blood test to measure prostate-specific antigen, PSA, and a digital rectal exam, DRE, to feel the prostate. These basic tests can help detect prostate cancer early. We recommend annual prostate cancer screenings for men over 50, and for those with family history, screening should begin earlier from age 40. You know, here in Canada, we have clear guidelines for colonoscopies and endoscopies, recommending them every few years for general health checkups. But there are no such widespread guidelines recommending regular cystoscopies, bladder scopes, for bladder cancer screening. Why is that? It's often because it's a cancer people prefer to avoid thinking about. People are hesitant to visit urologists. If regular bladder scopes were as common as colonoscopies, we could detect bladder cancer much earlier, and the chances of a cure would be significantly higher. Making this a more widely accepted and routine part of our healthcare is a crucial point for the future. My fellow Canadians, after 47 years of serving this community, I've come to understand that the biggest barrier to your health is often not the disease itself, but the hesitation to speak up, to ask, to get checked. Don't let discomfort or a busy schedule overshadow the subtle signals your body sends. Your future self, your family, and your quality of life depend on the proactive choices you make today. It's not just about treating illness. It's about embracing every healthy year ahead with confidence and vitality. If this message has resonated with you, if it has empowered you to take that vital step, please consider joining our Urologist Canada community. Like this video, subscribe to our channel, and share this crucial information with someone you care about. Together, we can ensure more Canadian men live full, healthy lives, free from the silent burden of preventable disease.